Hello, good morning. Welcome to the lecture today on dengue. So come we'll have an introduction to dengue and then the epidemiology of dengue and then the problem of dengue in India, and then we'll focus on prevention and control of this disease and how the efforts are being made to control the disease. So here what we need to know is a basic thing that dengue is a mosquito-borne viral infection. Okay, it's a global health problem. It's not just limited to India or some tropical countries, commonly found in tropical and subtropical countries, but it is around the world. It is found in every country. No country is exempt from dengue infection. So the symptoms can range from mild fever to life-threatening complications. So three things which we need to know are here that it's a mosquito-borne viral infection, not a bacterial or anything. It's a viral infection. Second thing is of global public health importance, and the third thing is it commonly occurs in tropical and subtropical regions, but it does not. It is also found in other countries, but commonly found in tropical and subtropical countries. And the fourth thing is it can have symptoms which range from mild fever to life-threatening complications. So epidemiology of dengue will speak about incidence and prevalence, the global burden, the demographic factors, and the emerging trends. So the incidence and prevalence, dengue is a major public health concern with an estimated 390 million infections occurring annually. So over a period of 1 year, around 390 million infections occur in over 100 endemic countries. Just imagine the magnitude of the infection. So around 150 countries are there throughout the world. In that, dengue is endemic in around 100 countries. So in over 100 countries, dengue is endemic, and 390 million infections they occur annually, that is every year. So you can imagine the burden it causes. So it commonly occurs in tropical and subtropical regions, but it can occur in other countries also. So it can cause significant morbidity and mortality. People can suffer as well as people can die because of dengue. So dengue is a serious problem which needs to be combated at every step. So the demographic factors, it disproportionately affects urban population, children, young adults. Okay, disproportionately, not proportionate, not like it affects only urban people, it affects rural population also. It does not affect only children, it affects young adults also, as well as old people. So with social economic status and access to healthcare influencing disease impact. So if healthcare accessibility is not found, or it is not accessible, then the complications because of the disease tend to be severe. So the emerging trends like urbanization, climate change, increased global travel, these are the three things: urbanization, climate change, increased global travel. They have all contributed to the spread of dengue throughout the world. Okay, so incidence of dengue has increased worldwide because of these three factors, common factors: urbanization, climate change and increased global travel. So next, transmission dynamics. So, as we know that dengue is a viral infection. Now it is primarily transmitted through the bite of female Aedes aegypti and Aedes albopicus mosquitoes. So Aedes species and female species of Aedes mosquitoes, they transmit dengue primarily. So these mosquitoes, they pick up the dengue virus when they feed on infected humans and can then transmit the virus to other people through subsequent bites. So they take up the dengue virus from sick people, the people who are already harboring dengue virus, and then they transmit it to normal humans. They infect the normal humans, and then thus this human mosquito cycle continues. So the virus replicates in the mosquito's body and eventually reaches its salivary glands, enabling the mosquito to inject the virus into a new human host during feeding. So this is essential for ongoing transmission of dengue. So this dengue is commonly transmitted from a sick person. The Aedes mosquito takes it, the female Aedes mosquito takes the blood, and then the mosquito's blood reaches the salivary glands from the body. The virus replicates in the mosquito's body, and then it reaches the salivary glands, and through the salivary glands it again gets injected in a normal healthy person, where the virus continues to spread. So this mosquito dengue or human mosquito cycle, that is essential for the ongoing transmission of dengue. Now, geographical distribution. We'll study under three headings. Global reach. Dengue is prevalent across tropical and subtropical regions worldwide, affecting over 100 countries and territories. So more than 100 countries are endemic for dengue. Dengue, which was not a problem around 50 years back, is now a global health problem. It is commonly seen in 100 countries where it is endemic. So dengue is prevalent across tropical and subtropical regions worldwide. Globally it is prevalent. So endemic hotspots. The high burden areas include Southeast Asia, Western Pacific, the Americas. Even the Americas, the most developed countries in the world, are not spared, and parts of Africa and the Eastern Mediterranean. These are the high burden areas for dengue disease or the fever or whatever the infection. These are the high risk or high burden areas where dengue is found to be endemic. Let me remind you here, endemic is defined as the constant presence of an infectious agent throughout the year. At least one case you will find it throughout the year in that geographical area. Then it is called endemic. So you can, in 100 endemic countries, you will find at least one case throughout the year. But the high burden areas, they include Southeast Asia. Southeast Asia, especially this Philippines, Indonesia, Malaysia, these are the places. The Western Pacific, the Americas, parts of Africa and Eastern Mediterranean region is considered to be endemic hotspots. Endemic hotspots and then expanding footprint. Because of now two things like climate change and globalization, the geographic range of dengue has expanded in recent decades, reaching new populations. Now this is a few further thing. What used to be just endemic hotspots, now they have expanded to other countries apart from those countries which are been listed above as endemic hotspots, the other places are also now being affected because of two major things, that is globalization and climate change. So this climate change is responsible for the spread of dengue in places where it was not known also. So the seasonal patterns. Dengue exhibits distinct seasonal patterns with incidence typically peaking during the rainy season in tropical and subtropical regions. In tropical and subtropical regions where there are rains, at that time the incidence of dengue peaks. It increases. Rainfall, temperature and humidity are key factors driving the population dynamics of Aedes mosquito vectors and virus transmission. So remember, these three factors are responsible for increased incidence of dengue. Okay, so rainfall, temperature and humidity, these are the three key factors which are responsible for increased incidence of dengue and virus transmission. Then they are observed across the global endemic areas, often coinciding with the periods of increased mosquito activity and favorable environmental conditions for viral replication and spread. So as I already said, that the favorable environmental conditions, or the environmental conditions that are favorable for viral transmission and increased mosquito activity are the three: rainfall, temperature and humidity. These are the three key factors which are responsible for dengue transmission as well as the increased mosquito activity. Mosquito activity is increased because of rainfall, and when the water collects, the ideal temperature and humidity is ideal for the mosquito to lay eggs, and the new generation comes out because of these three factors. So these three factors are responsible for increased incidence of dengue, or increased mosquito activity and viral transmission. So what are the risk factors? Commonly, the geographic location, the socio-economic status, age and immunity. So geographic location, the people living in tropical and subtropical regions increases exposure to dengue carrying mosquitoes, or the mosquitoes commonly they inhabit or they commonly live in tropical and subtropical countries. It doesn't mean that the people from people living in countries which are not tropical or subtropical, they are exempted from getting dengue. No, even countries which do not fall in tropical and subtropical regions, they are also now endemic for dengue. So this is a major problem, because rainfall occurs everywhere, humidity is everywhere, temperatures, favorable temperatures are there in every country. So socio-economic status, let me reiterate one point here, that socio-economic status does not play a role for getting dengue. Even the rich get dengue. Many of the film producers, maybe you might be knowing S. Chopra, the famous film producer, he died because of dengue. Although he was a rich man, he died because of dengue. So any socio-economic status, or any person higher or lower with higher or lower socio-economic status can still get it. But lower socio-economic status communities, they are more prone. Why? Because of lack of adequate sanitation, mosquito control measures. Okay, so these are the two things: sanitation measures as well as lack of mosquito control measures. No mosquito nets, nothing, no full sleeves clothes, or no clothes for some time. So this low socioeconomic status can contribute to increased incidence, whereas other socioeconomic status, high socioeconomic status, also can people with in high socioeconomic status or the rich people also can get it. So age and immunity, younger individuals and those without prior dengue exposure are more susceptible to infection. The kids, commonly the dengue morbidity and mortality is commonly seen in kids, the children who are exposed to the mosquito bites more than the adults. The adults are commonly fully covered. They wear full sleeves clothes, covered, their neck covered. Sometimes they wear a headscarf, gloves, socks, or the adult males, they wear full sleeve clothes, socks, all those parts are covered. Whereas kids are in shorts, they remove the shirt sometimes to play. So they are more at risk of getting bitten by mosquitoes that transmit dengue, or the mosquitoes, that is these Aedes aegypti and albopicus. They are day biters. They bite in the day, not in the night, especially when the sun is rising and when the sun is setting. At that time light intensity is low. At that time these mosquitoes tend to bite. So surveillance and reporting, the importance of surveillance. The robust dengue surveillance systems are crucial for monitoring disease trends, detecting outbreaks, and guiding prevention and control efforts. So a proper surveillance system in place can detect dengue outbreaks, the disease trends, and these disease trends can guide in prevention and control of the outbreaks in future. Then the surveillance methods, they include passive case reporting, active case detection, entomological monitoring, and zero prevalence studies. So the 4 types of surveillance approaches include active case detection, passive case reporting, monitoring of the mosquito or entomological monitoring, and monitoring of antibodies in the blood or zero prevalence studies. So the surveillance methods, they include these 4 types of 4 methods. Now reporting mechanisms, they are the standardized reporting protocols and transparent data sharing platforms enable coordinated regional and global dengue surveillance. So standardized reporting protocols have been developed by international bodies so that the problem of dengue is reported in a standard reporting format. Now the challenges and improvements, these challenges include underreporting. People underreport, limited laboratory capacity where it's difficult to diagnose dengue, and delays in data processing. And improvements can be innovations like digital tools to enhance surveillance. So now it's the era of intelligence, artificial intelligence, that can be used to enhance surveillance. So this regarding surveillance in reporting. Challenges in dengue control. First one is surveillance. The inadequate reporting and data collection, these are the challenges. And vector control. Now because of repeatedly using the same insecticides, there is a problem of resistance to insecticides and a complex life cycle of the mosquito. And then the other challenges are health systems, lack of resources, access to care. Many communities are still lack access to the healthcare systems where dengue can be treated, or the symptoms of dengue are treated. So as you know, dengue does not have a specific treatment. We need to go for symptomatic treatment. So even that care, the doctors, either the doctors are not available, or the hospitals are not there, or access is not possible, no buses, nothing, no mode of transportation to the hospital. All these are challenges that can occur to control dengue. And public awareness, insufficient knowledge about prevention. People don't know how to prevent. They just want treatment from the doctors, whereas there is no specific treatment, but they don't know how to prevent. So awareness regarding how to prevent dengue is lacking among the general public. So controlling the spread of dengue poses significant challenges. Weaknesses in disease surveillance and reporting hinder accurate monitoring. Vector control efforts are complicated by growing insecticide resistance and the complex life cycle of Aedes mosquito. Overburdened health systems struggle to provide adequate care. Public awareness and engagement remains low in many affected regions. This is a summary of the things which have been told. Now, emerging trends and innovations. Advanced diagnostics, genetic modifications, improved surveillance, so advanced diagnostics, new rapid diagnostic tests are improving early detection of dengue, enabling faster treatment and reducing disease spread. Genetic modifications, innovative techniques like genetically modifying mosquitoes to suppress populations are being explored, like the sterile male technique, all these things. Genetic modification. Then improved surveillance, advanced surveillance system using satellite data and machine learning are providing deeper insights into dengue epidemiology. Vaccine development, research is underway for new, more effective dengue vaccines that could revolutionize prevention and control efforts. Conclusion and future directions. In conclusion, the epidemiology of dengue reveals a complex and evolving public health challenges. As we look to the future, continued research, surveillance, and innovative control strategies will be crucial in reducing the growing burden of this disease. Vaccine development and vector control measures are the two key factors which have to be focused upon in future to control dengue and related diseases. So now we'll speak about introduction to dengue in India. So as you know, in the previous slides we spoke about more than 100 countries that are endemic to dengue, where dengue is endemic. So more than 100 countries where dengue is an endemic. So even India is a country where dengue is endemic. It's as you know, a small recap, it's a mosquito-borne viral illness of major public health concern, and it is characterized by symptoms like a fever, headache, muscle, joint pain, and a skin rash. So, as you see, dengue in India is commonly seen in West Bengal, Uttar Pradesh, Punjab, Haryana, Delhi, Gujarat, Kerala, Karnataka, and Tamil Nadu. This is according to National Center for Vector-Borne Disease Control. So, globally, an estimated 33, based on the global data, globally it is 390 million cases occur annually, as I have said in the previous slides. Whereas the burden in India is estimated to be around 33 million dengue cases occur each year. Out of 390 million in the world, 33 million are contributed by India. So, an increasing number of dengue cases and fatalities are being reported. So, now this 33 million were seen in 2013. That is, at that time there were just 100 million throughout the world. Of that, 1/3 of the total global burden was contributed by India. You can imagine it was 100 million 10 years back, or 11 years back to be precise. It was 100 million, whereas now it is 390 million. So a four-fold increase in a span of 11 years shows how big the problem of dengue is throughout the world. If you say 1/3 of the total burden is from India, and 390 means 130 million cases or clinically apparent cases throughout the year can be reported from India. It's not surprising to say that, because it's a common disease nowadays. So, throughout India, the commonly seen states are Karnataka and Kerala. Where dengue is an endemic. That I'll tell you in the future slides. Now, epidemiology of dengue in India. Burden of disease. As you know, dengue is a major public health concern in India, with millions of cases reported annually and significant morbidity and mortality. Many people die of dengue every year in India. So, this is a disease that cannot be neglected in any aspect. So, geographic spread. The disease has spread across various states with outbreaks occurring in both urban and rural areas, reflecting its widespread presence. So, you can imagine it is there in both urban areas and rural areas. We contribute urbanization as a part of problem creating scenario, but it is also seen in rural areas. So, both in urban areas and rural areas, it is the dengue is seen in India. The seasonal trends, commonly rainy season and post rainy season, that is dengue incidence. It peaks during monsoon, that is during rainy season, and post monsoon seasons, that is after the rains have stopped, driven by favorable climate conditions for the mosquito vector. The post rain, the rain that gets collected in the environment, acts as a place, a reservoir for the eggs to be laid. So, post rainy season, if it is dry, if it is complete summer, we can expect less burden of dengue, because there is no place for the dengue mosquito or Aedes mosquito to lay its eggs, because the water would have dried up because of the extreme summer or extreme heat. The water would have dried out, no artificial collection of water, and then mosquitoes, they stop breeding. Although you cannot say zero breeding, because there are still fresh water collected in different places, even for drinking purposes. The overhead tanks, if they are not covered, they act or they serve as breeding places for Aedes mosquitoes. That is why dengue is an endemic, or that is, it means constantly it is present in the population throughout the year. So even if it is summer, people will not stop drinking water. So water in the overhead tanks, which are not covered, which are open, they act as reservoirs for dengue mosquitoes or the Aedes mosquitoes to lay their eggs in it. So the demographic factors are children, the elderly, and those with underlying health conditions are particularly vulnerable to severe dengue complications. Not dengue per se. Dengue can occur in any age group, irrespective of age, gender, anything. It can occur in any age group, any place, urban or rural, any socioeconomic status, whether it is rich or poor, anywhere it can occur. But the complications because of dengue are commonly seen in children, the elderly, and those with the underlying health conditions. So this is regarding epidemiology of dengue in India. Now the geographical distribution of dengue in India. As you are seeing in the map of India, maximum burden is from Kerala. According to this is a report which has been published in India Today in the year 2023. So the source is from National Center for Vector-Borne Disease Control. So the maximum number of cases where, or the maximum burden is from Kerala, where 9,770 cases were reported in 1 year, and then followed by Karnataka, followed by Maharashtra, followed by Orissa, followed by Uttar Pradesh, again followed by Assam, and then followed by Delhi. So the maximum load or maximum cases were found in Kerala, and then different states according to what has been shown in the map. You can see it is clear that it is commonly seen in Kerala and Karnataka, followed by the different states. And as you see, it's widespread throughout India. It doesn't mean that it doesn't occur in other places. It occurs in other states also, but commonly seen in these cases, these places. Tamil Nadu, Kerala, Andhra Pradesh, and West Bengal, they have the historical data. It shows that these are the dengue hotspots. And then urban and semi-urban areas are more prone to dengue outbreaks due to favorable mosquito breeding grounds such as stagnant water collection. So because of the stagnant water collection, that's the main reason for occurrence of dengue throughout the world, especially in India. So the seasonal patterns of dengue outbreaks. So here 3 things need to be addressed: peak seasons, the climate drivers, and regional variations. The peak seasons, as I said, monsoon season or the rainfall season and the post monsoon season. So this season is between July and November across much of India. So in this from July to November, monsoons are at peak. So you can expect rains occurring in this duration between July and November across India. So there will be stagnant water that acts as a breeding ground for the Aedes mosquito. That leads to increase in number of dengue cases. So the climate drivers, it can be warmer temperatures, higher humidity and stagnant water. During the monsoons, it creates an ideal breeding condition for Aedes mosquito, fueling dengue transmission. So the mosquitoes, they breed during monsoon and where conditions are favorable for breeding. So the conditions favorable for breeding are the temperature should be a little bit warm, then humidity should be high and water should be stagnant. A place, a stagnant water where the mosquitoes can breed ideally. And then regional variations. Seasonal patterns can vary by regions, with some areas experiencing bimodal peaks or extended transmission throughout the year due to local climate variations. So anytime, that's why we need to keep in mind that dengue is not a seasonal disease, it is an endemic disease. It is a disease which is commonly seen throughout the year. But peaks can occur during monsoons or post monsoons, where you can expect rainfall and subsequently stagnant water is found where the mosquitoes breed. Now, dengue demographic factors that influence dengue incidence. First is age distribution, gender dynamics, socio-economic status, ethnic variations. As I told earlier, no age is exempt from dengue. No gender is exempt from dengue. No socio-economic status is exempt from dengue. No ethnicity, no religion, no caste, no ethnic group is exempt from developing or getting dengue. But there are some reasons, which some factors which have been found by way of research. Dengue disproportionately affects younger population, with children and young adults being most susceptible. Doesn't mean that other ages are not susceptible, but most susceptible are the children and the younger adults. So maybe this is due to a combination of exposure risk. The kids, as I told earlier, the kids will not be in full clothing. They will be wearing shorts or half shirt or in banyan or without the shirt while playing. So they are more at risk of getting bitten by the mosquito, because as we know that the mosquito that causes or that transmits dengue is Aedes, and Aedes is a day biter. So it bites in the day. Night, if it is a night biter, you can put a mosquito net and sleep, nothing happens. Whereas day, you cannot put a mosquito net and play. So if you are playing out, younger adults and kids are at risk of getting dengue more than the adults who are usually wearing pants and full sleeved clothes. So the kids are more susceptible. So maybe because of that, because of the exposure risk, as well as some weaker immunity. So this is the age distribution. Then gender dynamics. As we know, as I told you, that both the genders are equally susceptible or equally at risk of getting dengue, but some studies have found that women have a higher incidence rates due to differences in household responsibilities and mosquito exposure. So women have been found to be more susceptible due to household responsibilities and exposure to mosquitoes. Doesn't mean that males will not get it. Even males are also equally susceptible. But because the exposure rate is high among women in India, because of their dressing sense, where the exposed area is generally when they wear saris, the majority of the people or majority of the females in India wear saris where the abdomen is exposed, and they don't wear the full sleeved blouse, half sleeved blouse, so even the arms are exposed, and nobody has, or commonly the head is not covered and the neck is also exposed. So the neck is also a place where mosquitoes can bite, or the arms or the legs. Okay, so these are not fully covered, or the abdomen commonly. The legs are also covered, but the feet are generally open. So from the ankle onwards, the mosquito can bite anywhere. So hence, females in India have a higher susceptibility of getting bitten by the mosquito. So this is regarding gender dynamics. Next is socio-economic status. Earlier in the presentation, I told you that people, irrespective of rich or poor, can get it. One of the famous film producers, a very rich man, he died because of dengue. Why? Was he not rich? He was rich. Didn't he was exposed to dengue by exposed to the mosquito, which leads or which transmits dengue, and the poor producer, I mean a rich producer who was exposed, got affected and died. So it tends to be more prevalent in lower income areas with, now here is the catch, lower income areas. It is seen in higher income people also, but since they have access to healthcare and they have the timely treatment, although there is no treatment, timely prevention and spending in preventive aspects, putting mosquito repellents, purchasing mosquito repellents, and then safeguarding their houses with the mosquito meshes, window meshes, many things. So the income is responsible in preventing, whereas in a low income areas there is inadequate access to healthcare and sanitation, poverty, overcrowding, and lack of resources. They contribute to increased mosquito breeding grounds. So in front of a poor man's house, you cannot expect cement or a flooring to be proper. There will be some ground or some low level, some potholes where water can collect, and because water, if is stagnant for a long period of time, mosquitoes can breed there, and the poor man is exposed to the risk of dengue. That is why, whereas a rich person, a person with high income, they have a properly constructed houses with window mesh installed. So, and even indoors, the mosquitoes cannot enter, and hence he is protected. If he is exposed, even if a rich man is exposed, then he can get it. But because of his money, because of his high income, his standard of living, he is not exposed, and hence he is less susceptible than the lower income people. So the socio-economic status also plays a role. Now, ethnic variations, certain ethnic groups exhibit genetic or cultural factors that influence their susceptibility to dengue. Further research is needed to understand these complex relationships. So, at present, the research points out that some ethnic groups are less susceptible. So, that research is not complete, and hence we cannot comment on which ethnic groups and what are the factors that are responsible for reduced susceptibility in some ethnic groups. Now, socio-economic transmission of or socio-economic determinants of dengue transmission. As you see, there is a study which has been done which says that the socio-economic and environmental determinants of dengue. We can see low socio-economic status, low income, low education. Now these are the things which are associated with dengue. Low such a, in previous slide I explained low socio-economic status involves easy exposure to the dengue mosquito. So low income also they cannot build they cannot afford to put meshes in the house, in the windows. So low income, they tend to get exposed to the mosquito and get dengue. And low education, because of low education they do not know how dengue can be prevented. Low literacy, lack of knowledge about dengue, people lack knowledge about dengue. Presence of economically inactive people in the household, unemployed, students, so they are all exposed to the risk of getting dengue among them. So the other things, poverty, lack of access to clean water, sanitation, overcrowded living conditions are major socio-economic factors that contribute to the spread of dengue fever in India. So these factors create ideal breeding grounds for the mosquito vector. As I said, poverty, because of poverty they cannot create their houses are surrounded by stagnant water. Their houses are surrounded by potholes which act as breeding grounds. After rains, the rainwater gets collected, they act as breeding grounds, and mosquito breeds freely in that breeding ground in the potholes, and the people are exposed to the mosquito and then they develop dengue. So inadequate public health infrastructure, limited access to quality health care in low income communities, it further exacerbates the burden of dengue outbreaks among the most vulnerable population. Imagine there is no hospital, imagine there is a hospital is away, far off from the place where you live. Imagine that the roads are not proper, you cannot go. Imagine there is a hospital, there are no doctors there. So, all these are the social factors that are responsible for higher morbidity and mortality in dengue. So, the role of urbanization in dengue spread. Now, initially we said that there is no rural urban variation, both in rural areas as well as urban areas, people are susceptible. Here, we say that urbanization is partly responsible for people to get exposed to the risk of dengue. Now, these are the four factors which are responsible for spread of dengue in urban population. The first one, increasing population density. Then the second one, inadequate infrastructure. Third is changes in mosquito habitat. Fourth is increased mobility. So, increasing population density, here rapid urbanization has led to overcrowding and high population density in many Indian cities, providing ideal conditions for the proliferation of the Aedes mosquito that transmit dengue. So, if there is increased population density, then the mosquitoes, which can generally the mosquito Aedes mosquito can bite or can get where the place from where it breeds, it can fly up to a range of half a kilometer to bite the person, the susceptible person. So, if there is increased population density, there are more chances of people getting bitten by the mosquito. So, increased population density, inadequate infrastructure, poor urban planning, lack of proper waste management, and insufficient access to clean water in growing cities contribute to the breeding of dengue mosquito. So, proper waste management is, or waste is not properly disposed, and then the water which is produced, the sewage water or the water which is used for cleaning in the house, the fresh water that is used for cleaning in the house, or the water which is supplied, if it is not closed, the water which flows from the tap towards outside of the house, and if it is not cleaned, or if it is not emptied, or it is not dried up, it acts as a breeding ground for the Aedes mosquito. Then changes in mosquito habitat. Urbanization has transformed natural environments, creating new mosquito habitats in artificial containers, abandoned buildings, stagnant water sources found in urban areas. For example, people, they drink coconut water and throw the coconut shells. They use tires, and those tires, used tires, are generally thrown on the terrace of the house. Now, these used tires or the empty coconut shells, they collect water after rainfall. They collect water. The water is collected in the empty coconut shells as well as the tires, and that stagnant water acts as a reservoir where, or acts as a breeding ground for Aedes mosquito. So that's why we need to see that this waste, especially the coconut shells, are properly disposed of, and water is not allowed to collect in these artificial collections. Then increased mobility, rapid transportation and migration within and between cities has facilitated the spread of dengue virus and introduced new viral strains to previously unaffected regions. Now, a person with dengue, if he travels to some other place, the mosquito can breed any place that can pick up the virus from the affected person in a new place and can transmit to other people. So this is how the dengue spreads from one place to another. So then challenges in dengue surveillance and reporting. Now this has been covered in the previous slides. That's why I'll just pass through fast. So these are the challenges: underreporting, limited diagnostics, inconsistent data. So underreporting of cases, and this leads to many cases go undiagnosed and unreported. So they think that this is just a plain viral fever. People get killed, and it is not since it is not diagnosed, it is not reported. Limited diagnostics, lack of access to reliable diagnostic test hinders accurate case detection. Hence, many cases are not diagnosed properly. Many cases occur, they mimic other viral infections. Viral infection, generally the dengue symptoms are non-specific symptoms like myalgia, bone pain, pain behind that is retrobulbar pain behind the eyes, headache, fever, of the stepladder pattern. So we have all these, but people mistakenly take it as some other viral fever, and if he gets all right within 4 to 5 days, thinks that it's just a common viral fever. They don't get it tested. Now even testing also requires money. Low income groups, they don't have money to get tested, or even if high income groups, even if they have money, the hospitals where they visit, they might not have the required kits to test for dengue virus, and hence that lack of reliable diagnostic tests hinders accurate case detection. And then inconsistent data, varied reporting standards across different regions make national data unreliable. So proper data is not reported, and hence data is not consistent. So emerging trends in dengue epidemiology: changing incidence patterns, emerging dengue serotypes, and expanding geographical range. So changing incidence patterns, dengue cases have been steadily increasing in India, with outbreaks becoming more frequent. So maybe because of urbanization, climate change, and globalization. People with dengue, they travel in different parts of country, and people from different countries with dengue, they travel to India, and hence we can attribute that to the spread of dengue in places where dengue is not known. Then emerging dengue serotypes. New dengue virus serotypes are emerging, leading to increased risk of severe disease. So an ongoing surveillance is critical to monitor these epidemiological shifts. Then expanding geographical range. Dengue is spreading to new regions of India, likely driven by changes in vector ecology, human mobility. People with dengue can travel to places where dengue has not been reported and the mosquito is already there waiting to bite the person who's having dengue virus and transmit that virus to healthy humans who then again get dengue. So because of human mobility, dengue gets transmitted or expanded. So identifying high risk areas is crucial for targeting prevention efforts. Now strategies for control of dengue in India. First is strengthening surveillance. Real-time data collection and analysis should be done. The surveillance systems need to be strengthened. Then integrated vector management. Adopt comprehensive mosquito control strategies that includes reduction in the source or source reduction, putting of larvicides, and engagement of the community to eliminate Aedes mosquito breeding sites, improving healthcare access, improving or making available local dispensaries with proper doctors and educating the doctors of newer trends. So the old doctors will be not knowing about the newer trends, hence continuing medical education to the older doctors, along with high quality dengue diagnosis and treatment services, provision of proper diagnostic tests to the PHCs and local treatment facilities, public awareness and education. So targeted public health campaigns to the public regarding knowledge on how to prevent dengue, the symptoms of dengue, and how early care can lead to prevention of complications. These things need to be told to the public. Then research and innovation. Invest in research for developing effective vaccines, treatment, the drugs, and new vector control tools to enhance India's preparedness and resilience against dengue. Thank you. Coming to prevention and control of dengue. Dengue, as we know, we have been telling the clinical manifestations of dengue. So we need to diagnose it early to prevent complications. So these are the symptoms which are commonly seen in dengue. A fever is definitely, it should be there since it is a dengue fever. Along with that, eye pain, muscle pain, headache, nausea and vomiting, bone pain, joint pain, and a typical rash in dengue. So sudden onset of high fever associated with severe headache, muscle or joint pain, and fatigue. Rash may develop ranging from a mild maculopapular rash to severe confluent petechial rash, petechiae, and a decreased platelet count and increased hematocrit levels may indicate plasma leakage, a hallmark of severe dengue. So two things, decreased platelet count and increased hematocrit, can indicate that there is some plasma leakage, and that indicates the severe dengue, whereas all others are non-specific symptoms. So diagnostic and laboratory testing. As you see in the flow chart, if duration is less than 3 days, RT-PCR and ELISA along with NS1 needs to be done. If it is found negative, then it is not there. Dengue IgM detection, the antibody detection should be done. Again, if it is negative, then again after 2 to 4 days, again IgM antibody detection needs to be done. If it is negative, then there is no dengue infection. Whereas in less than 3 days, if RT-PCR, ELISA or NS1 is positive, then we expect that it is positive, it is dengue infection is confirmed. Again, if it is more than 3 days, dengue IgM detection or antibody detection should be done, and if it is positive, then it is dengue infection is confirmed. If it is negative, the antibodies are negative after 3 days, NS1 and ELISA should be done, and they are found to be positive, then also dengue infection is confirmed. So, accurate diagnosis of dengue is crucial for appropriate patient management. Laboratory testing includes detection of viral antigens, antibodies, IgM antibodies, or genetic material. Rapid diagnostic tests and RT-PCR assays are commonly used to confirm dengue infection early in the illness. So the rapid diagnostic test can be detection of NS1 antigen. Serological tests like ELISA and detection of dengue specific IgM and IgG antibodies are important for differentiation from other viral illnesses. So supportive care and treatment. So generally these three are the things which need to be done. The first thing is fluid management, symptomatic relief, platelet monitoring. So people can be with mild dengue can be cared for at home. See that they get lot of rest, give them plenty of fluids, have them rest or sleep under a net or wear a repellent. Paracetamol can be given. Don't give aspirin or ibuprofen because it can lead to a Reyes syndrome. Then learn the warning signs of severe dengue. If they show, take them to the hospital immediately. If there are petechial hemorrhages, then take them to the hospital immediately. Then while taking care of others, use repellent and wear light long sleeved clothes so that the person who is taking care of the dengue affected case also is not exposed to the mosquitoes. So the fluid management needs to be intravenous fluid therapy is crucial to maintain hydration and electrolyte balance during the critical phase of dengue illness. Now this is in hospital. In the home you can care with all the things which have been told and where the other things are depicted in the slide. Whereas in the hospital, IV fluid therapy is crucial. And then symptomatic relief. Medications like acetaminophen or paracetamol can be used to alleviate fever, pain and discomfort associated with dengue infections. And then monitoring, platelet monitoring, close monitoring of platelet counts is important to detect and manage bleeding complications that may arise during severe dengue. So these are the mainstays of supportive care and treatment. A word about dengue vaccine, research and testing, vaccine administration and ongoing developments. So developing a safe and effective dengue vaccine requires extensive research and clinical trials. So the vaccine, once if it is approved, the vaccine should need to be widely distributed and administered to populations at risk. And the ongoing developments, researchers continue to work on improving dengue vaccines, exploring new technologies and approaches to enhance their effectiveness and accessibility. As you can see on the left hand side of the slide, you can see there are three types of vaccines: Dengvaxia, Denvax, and TV003 or TV005. So we can see the efficacy. The Dengvaxia is effective against all the four serotypes: DEN1, DEN2, DEN3, and DN4. Whereas Denvax is effective against DEN1, 2, and 4, not effective against DEN3. So overall efficacy 30 to 60% in Dengvaxia, 62% Denvax. Data is not available for TV003 and 005. So similar things, efficacy, seropositivity and seronegativity also are displayed in the slide. So the preventive strategies: practice the 4S in dengue prevention and control, search and destroy mosquito breeding sites. As I said, the artificial collections, the tires, the coconut shells, the potholes around your house. So all these things need to be destroyed. Self-protection measures: wear full-sleeved clothes, wear pants, try to wear headscarves, females, or try to wear full-collared shirts, and apply mosquito repellents to the skin that is exposed. And the third S is say no to indiscriminate fogging. Fogging doesn't help in stopping the mosquitoes from breeding. And fourth S is seek early consultation. As soon as you feel that you have dengue, get tested early. So the preventive strategies include mosquito control, personal protection, public awareness, and integrated approach. So effective mosquito control is crucial to prevent dengue. So this mosquito control can be done by eliminating breeding sites, then putting larvicides in the places where the breeding sites are there. Then community-wide fogging and spraying programs can be taken effectively. Individuals' personal protection: they can use insect repellents, wear long sleeves and pants, installing window screens to keep mosquitoes out of homes. Then public awareness can be done to the public can be made aware regarding transmission, the symptoms, how preventive measures can lead to effective prevention of dengue. So outreach campaigns and community engagement can empower people to take action. So you need to involve the community to eliminate the breeding sites. And then the integrated approach, like combining vector control, personal protection, as well as public awareness. All the three which we told: mosquito control, personal protection, and public awareness, all these three, if done together, then it is called integrated approach. The integrated vector management, as you can see, environmental management by source reduction, then chemical methods used of use of adulticides and larvicides. So larvicides like Temefos, adulticiding by thermal fogging, ultra low volume spraying. Then biological and biochemical methods, use of larvivorous fishes like Gambusia and guppy fish, and using of bacteria like Bacillus thuringiensis. Then intersectoral collaboration and health education and enforcement of law from the government. So the surveillance, source reduction, vector control, community engagement, and policy and regulation. Surveillance, continuous monitoring of mosquito population and disease cases. Reduction of source by eliminating the breeding sites by environmental management. Vector control by application of larvicides and adulticides in places where breeding of mosquitoes is seen, and engagement of the community or involvement of the community for prevention and control measures. Policy and regulation, establishing laws and guidelines for effective vector management. This is integrated vector management. And then community involvement. How can community be involved? As you can see on the right hand side of the slide, the tiger mosquito dengue fever vector. Then you can clean water for every week the water needs to be emptied if it is open. And if a child has fever, he must be taken to the health center urgently. Burn rubbish, bury rubbish, control sewage. So this community can help in this way. Community can be involved by the way of education campaigns, volunteer initiatives, neighborhood cleanup, and reporting systems. So educational campaigns can include raising awareness regarding dengue transmission, symptoms, and prevention by doing community events, programs in schools, and through various forms of media. Volunteer initiatives encourage residents to participate in elimination of breeding sites of mosquitoes. Then ask the residents to put larvicides in the places where mosquito breeding sites are found, and inspect their houses as to where the foci of mosquito breeding sites can be seen. Neighborhood cleanup, need to see whether potholes or any places where these artificial breeding sites like mosquito shells, then used tires are thrown indiscriminately, where water gets collected and acts as a breeding site, that needs to be eliminated. Empower residents to report suspected dengue cases and potential mosquito breeding sites to local health authorities. So the preventive policies by the government. So the policy development, funding and resources, regulatory frameworks, and coordination and collaboration. Government play a crucial role in establishing comprehensive policies. So they need to do the vector control measures, and they need to make the public aware of how to prevent or how to eliminate the breeding sites. The government needs to provide adequate funds and resources for implementing dengue prevention programs, surveillance, research, and community based interventions. So government should also develop and enforce laws to ensure the proper handling and disposal of water containers, as well as the responsible use of pesticides, larvicides, adulticides, and other vector control measures. Then coordination and collaboration. Interagency coordination and collaboration among various government departments, healthcare providers, and community organizations. They all should work together to eliminate dengue. So different departments should work together to eliminate dengue. So conclusions and future directions. In conclusion, the prevention, treatment, and control of dengue requires a comprehensive and coordinated approach involving healthcare systems, communities, and government policies. Ongoing research and development of effective dengue vaccines, they hold promise for the future. However, simple measures like continued vigilance and strengthening of surveillance, integrated vector management strategies, they are crucial. Instead of waiting for vaccines to be developed, these three things, a strengthened surveillance, continued vigilance, keep a watch continuously, and integrated vector management as discussed above, if they are done effectively, then dengue can be prevented in the population. Thank you for your patient following of the slides. Thanks for watching. Goodbye.